Hi, my name is Carrie Med, and this video is for SIMS499 Activity 4, and it's going to review the project objectives and strategies regarding neonatal skincare and improving that within the NICU. When addressing the skincare of neonates, there are 5 different areas that by improving skincare will improve our neonates' health outcomes and the care provided based on the following. The first one is going to be decreased injury. Injury to the skin of neonates can occur for many different reasons. The outermost layer of the skin on a neonate is less than 30 weeks gestation age is typically only 2 to 3 layers compared to a term infant that's 10 to 20 layers thick. By being aware of the following injuries, education can be provided to nursing teams in order to help decrease their occurrences. The first type of injury we're going to talk about is going to be a medical device-related pressure injury. These injuries would be found on an infant that's using a device such as a feeding tube, a nasal cannula, or even a CPAP machine that's directly applying pressure to the neonate's skin. This, with proper assessment and skin barrier products, most skin injuries from these type of sources can be eliminated. Shear force is another injury, such as with elderly patients when moving them for positioning, brief changes, or linens. Neonates are also at risk of skin damage related to shear force. When handling neonates, it's imperative that gentle touch and careful positioning is used to prevent skin breakdown. Additionally, shear force can be considered an issue when changing diapers, cleaning peri areas, as well as bathing infants. Padding and gentle drying need to be used without any rubbing motions that can easily rub and tear neonate skin. Another injury is pressure-related injury. Pressure-related injuries, different than medical device-related pressure injuries, can be seen in neonates due to improper positioning and by not repositioning infants every 3 to 6 hours based on their stimulation requirements. An example would be small ears that can fold in, and when you lay on them, it can cause irritation or infection if not properly cared for, in addition to not being cleaned behind their little ears and their head where the dampness can occur and lead to breakdown. So right here is where I'm referring to. A lot of times their little ears will stick right to their little head, and you have to kind of open that up and do a nice gentle clean with sterile water and pat that dry where it's moist all the time. And when they're laying on their heads with positioning, if you're not getting that, they're going to end up with skin breakdown. Another thing is going to be decreased risk of infection. Bacterial and fungal infections on the skin of newborns can easily get into their bloodstream and result in neonates becoming septic. Sepsis is a dangerous condition that can result in not only critical illness, but even death. By caring for the neonate's skin appropriately and keeping it clean, dry, and intact, it reduces the chances of an infant obtaining that type of infection. An example would be bacterial infections related to diaper rashes that become excoriated. So excoriation is once it breaks the skin. It's no longer red and irritated. It's actually broken the skin, and it also usually starts bleeding. Another example would be a fungal infection that can grow on neonate skin that are being treated with humidity. A small tear in their skin due to injury can easily result in an internal fungal infection. So we're also going to look at a decrease in MARSI occurrences in the NICU. Medical adhesive-related skin injuries are one of the most common skin injuries in neonates. This is due to either improperly removing adhesive materials from the skin or from the adhesive not being secured on the neonate skin initially correctly. It is important to also regularly assess more active infants that can pull their medical devices from their skin and causing self-inflicted trauma. Some of those babies, just because they're tiny, doesn't mean they're not strong, and they're not wiggly, and they're not pulling at all of their lines. Positioning a neonate to decrease the occurrence of them being able to remove the tubing that has been secured correctly is a method of helping mitigate that type of issue as well. One of our goals is going to be improved comfort and rest from lack of painful stimuli. Touch, being one of the first senses to develop, is used via the skin and how neonates perceive and react to their environment of care. When infants experience painful stimuli, it prevents them from resting well, which in turn prevents them from being able to heal and to be able to grow. So it's very important to be able to allow them the comfort of not having painful stimuli, which any kind of skin breakdown is going to be a painful stimuli for them. We're also going to focus on improved quality of health. Currently, it appears that early pain stress may influence the developing brain and thereby neurodevelopment and stress-sensitive behaviors, particularly in our most immature neonates. Without the addition of stress and painful stimuli, a neonate can improve their quality of health and long-term health goals and growth and development. So this thus decreasing the length of stay they stay in the NICU, as well as decreasing the risk factors for other health complications. As nurses, we rarely work alone in the NICU. You can always have a team of nurses that focus on acute and long-term needs of each neonate. Teamwork in nursing requires superior coordination, information sharing, and collaboration across disciplines, and are required if value and outcomes are to improve. The 5 strategies that we're going to use to help reach the objectives for improved neonate skincare include a skincare quality team. This is going to be a designated group of nurses that work in the NICU that are going to work together to audit the skincare of neonates to ensure that any new policies and procedures that are going to be put in place for skincare are being followed and reflect less occurrences over a set period of time. Education of nurses and parents, education to both nurses, providers, team members, such as respiratory therapists, and parents of correct skincare treatment, positioning, diapering, and bathing as it relates to their interaction with the neonate. So education on not just how to do it, but any new products that we're going to remove or that we're going to add. We're going to be educating on. Policies and procedures, we are going to revise hospital and departmental policies and procedures that include current and updated recommendations for skincare for the very, very low birth weight infants, as well as all infants treated in the NICU. Sometimes you're going to have different types of care that you're going to give for a 26-week 1,000-gram baby versus a 37-week or 38-week 2,500-gram baby. Their skin's different, and it might be similar care, but it still might be different. Direction on, we're going to provide direction on how we're going to use adhesives, emollients, barrier creams, as well as adhesive removers. And we're also going to revise acceptable products based on evidence-based practice for skincare of very low birth weight infants. This would include products for adhesives, emollients, barrier creams, again, and adhesive removers. And then we're going to try and standardize bathing guidelines. We're going to recommend specific bathing guidelines for very low birth weight infants, as well as all of our neonates in the NICU. This is to prevent skin from becoming too dry from frequent bathing and excessive soap products on their skin that can result in breakdown. Overall, there's going to be several areas regarding neonatal skincare that can be improved upon with multiple strategies to help a NICU achieve those goals. Thank you for watching my video.